Oh, great. Praise God. Praise God. Praise God. Okay, great. All right. Hello, everybody. Yeah, yes, technology is special. Sometimes, um, actually, I didn't want to do that. Yeah, so I was just changing some of the specs, and that is why. Yeah, is I still getting used to it in terms of making me host and so on. All right, so there we go. Mm, right, you're all seeing the screen with the PowerPoint.
Yes, sir.
Okay, so pleasant good day, good afternoon to you all. Thanks for waiting on me. I was just getting things in order as it relates to the Zoom meeting. We shouldn't have any breaks in terms of the 45-minute, cutoff period. We should just go straight through. So, excuse me. Pleasant good afternoon to Chevelle, Gabrielle, Gemly, Giselle, Janaya, Kadisha, Kamina, Christina, Leah, Lakeisha, Michaela, Maria, Sabrina, Sadna, Sarita, Sienna, Tamira, and Makeda. Pleasant good afternoon. So this meeting will be recorded. Just make sure that indeed is the case. So it will be recorded, and yeah, it says recording. I see in the icon there. So it will be recorded, and it will be made available to you by 8 p.m. tonight. All right. So thus far, we have looked at blood. We didn't. Which PowerPoints or which chapters we looked at? We looked at blood, yes, and we look at the circulatory system, the heart.
Blood vessels and blood circulation.
So we look at blood vessels and blood circulation. Did we look at the heart in
No,
terms
not yet.
of sending it? Did I send a PowerPoint to you relating to the heart?
I
Not yet.
don't think so.
Yes, sir. Yes, sir.
Yeah.
You didn't
So I
send
sent
it
that.
yet.
Yeah. Okay. So I did send the heart,
And
right?
you said the blood vessels.
Blood vessels, right? So we didn't look at the blood specifically,
No, sir. Just send the
No,
lectures.
sir. You
right?
just
But
said like,
right. Do you all have access to the e-classroom?
yes, sir.
Okay, so there is the blood there. Dr. Sattar's lecture is there, but if notwithstanding that is on the e-classroom, I will also send a copy to you. All right, now in due course, I will go back over them, give a synopsis of it. But you can go through the lecture because Dr. Sattar lectures, she gave the lecture there, it's recorded. It's her YouTube video. So those three. So I wanted to press ahead just a little bit. So it's always good to get ahead of the game so we could slow down later. So I wanted to actually get into respiration today. All right. So today's lecture will be based on respiration. And then I'll be telling you all in terms of the e-classroom, what I would want you all to do in terms of worksheets and so on. Okay. So we good so far?
Yes, sir.
Yes, sir.
All right, so let's begin. So it is recording most critically. So let's begin. So you all are seeing the respiratory system. All right. Okay. So in terms of looking at the blood and um, looking at the blood and looking at the circulatory system, we would recognize its importance. One of the major things, of course, in terms of functionality associated with the blood is critical in terms of carrying oxygen throughout the entire body. And why do we need oxygen? Do we need oxygen?
Yes, sir.
Yeah, so we do need oxygen. I'm in a class at this time, I'll catch up in a classroom. Okay. Yeah. Why do we need oxygen? What do we use oxygen for?
To breathe.
To breathe, okay. And what do we use that oxygen? Okay, so we breathe, we take in the oxygen. We breathe out carbon dioxide. So what do we need it for? The oxygen, bottom line. What do we use that oxygen for? We use it for something.
To
Anybody?
help the body function.
Right. And what does the body do with the oxygen?
it breathing it and
There's something particular we use
no
that oxygen
carbon
for.
dioxide.
Now you know it, and when I tell you, you'll be like, "Oh gosh, I knew that." Blah blah blah. But what do we use that oxygen for? It has something to do with food.
Metabolism.
Yeah, you hit the nail on the head. Very good. Right? So, in terms of metabolism, is actually used to break down food. So, I don't know if you all remember that there's an equation that goes when you look at glucose, which is the simplest form of a sugar, glucose plus oxygen gives you carbon dioxide plus water plus energy. Yeah, or sometimes it's written out C6H12O6 plus 6O2 gives you 6CO2 plus 6H2O plus energy. Yeah, in terms of what happens at the level of the cell. But bottom line, that's what the major reason we take oxygen is to break down food. Very simple. Break down food. And why do we need to break down food? To release that energy. Why do we need that energy? Everything in our body that you could think about is actually needs energy. Muscle contraction and all the other processes, it needs oxygen, needs energy in the form of ATP. So that is one of the major things as it relates to respiration. Why we need that oxygen. All right, so let's see how the oxygen now is brought into our body. So respiration process of obtaining oxygen from the environment and delivering it to the cells. And then when the cells receive them, they break it down. So you have phases of respiration. You have the pulmonary ventilation, external gaseous exchange, which is from the external environment, gas transport in the blood, and internal gas exchange. So let's have a look at the lungs and see what's going on. So here we see in terms of internal exchange, blood actually leaves the blood, oxygen leaves the blood and goes to different tissues. And it does that by what process? How does it leave? There's a process that begins with D. It has to do with concentration gradients.
Diffusion.
Diffusion, excellent. So what happens is the gas actually diffuses from its area of high concentration to area of low concentration. So there's a low concentration of oxygen in the cell. Why is there a low concentration? Because the oxygen is being used up to break down sugar. Well, sugar is one simple form of food, but break down food at the level of the cell to produce energy. So obviously that oxygen is being used up, concentration of oxygen drops down. So therefore, when you have blood capillaries passing outside of the level of the cell, at the level of the cell, what you have happening is oxygen diffuses by moving down its concentration gradient from the blood where it's concentrated to the tissues themselves where it's not as much concentrated. All right, so then of course you have a reverse happening, carbon dioxide that actually does the same thing. It moves by diffusion from its area of high concentration, which is within the cells because the cells are using up oxygen, producing carbon dioxide as a waste product. So therefore the concentration of carbon dioxide goes up in the cells. So it now diffuses into the blood and is returned to the heart via the inferior and superior and inferior vena cavas. And then of course you have the pulmonary exchange. So what happens there? Well, you have the blood comes to the heart and it now leaves the heart. What is this blood vessel that carries blood to the lungs from the heart? I forgot. Is it the pulmonary vein or artery carrying deoxygenated blood? Well, it's
Pulmonary artery.
very good. Pulmonary artery. Now, usually arteries carry oxygenated blood, but in this case, it's carrying deoxygenated blood. So why didn't just call it the pulmonary vein? Well, there's another definition in terms of arteries and vein. Blood leaves the heart via arteries and returns to the heart via veins. So using that definition, the blood is leaving the heart here, but it's going to the lungs. So that's why it's actually called the pulmonary artery and not the pulmonary vein. Because even though it's carrying deoxygenated blood, this is blood that has been returned from the systemic circulation. But because of the fact it's leaving the heart, that's why it's called the pulmonary artery. So now it goes to the lungs, and again at the level of the alveoli, and we'll speak to this a little bit more in just a second. The gaseous exchange only occurs at the level of the alveoli. The exchange doesn't occur anywhere else. That's something very important to take note of. Right? Very important there that that we do have this this process occurring, right? Yeah, so we do have this process occurring where you have this gaseous exchange, but only at the levels of the alveoli. It doesn't take place anywhere else in the lung except at the alveoli. So that's something we look at in a little more detail. All right, and alveoli is something that looks like a bunch of grapes or a bunch of chenet, right? And they are crisscrossed by capillaries. Important thing with capillaries are one cell thick and they have spaces between them. So you do have in between the cells. So gas could pass in and out of capillaries. So therefore, at the level of the lungs, only place where gaseous exchange occurs is at the level of the capillary, and that's something very important to take note of. So, okay, so we have then, right, at the level of here, this is an alveolus. Alveoli is plural, an air sac in the lung, and this is just showing gaseous exchange. So carbon dioxide goes into the lung to be, of course, breathed out through the trachea. And of course, oxygen is returned into the alveoli via inspiration. So now you're breathing in high level of oxygen. The oxygen diffuses into the blood very simply because of it. There's a high concentration in the alveoli, low concentration in the circulating blood in the lung. So it now enters, and now oxygen-rich blood is returned via the pulmonary vein. Again, the reason why this is called the pulmonary vein is because veins usually bring blood to the heart, and that is only that definition is why they is used in defining this as the pulmonary vein. So here we have the pulmonary vein, the pulmonary artery. The blood is returned, and now it is pumped out via the major artery of the heart of the body, and that is, of course, the aorta. And then, of course, it either goes to the head, towards the head, or towards the body itself. So that's very important here. And of course, in terms of noting which side is which, this is the left side and this is the right side of the heart itself. How do we know it's the left side? Because the apex of the heart always points to the left. Okay. So let's look at the structure of the respiratory system itself. So when we're looking at it, the respiratory system, it conducts air into the lungs, and the major components, you have the nasal cavities, you have the pharynx and the larynx, which are associated with it, the trachea, which of course brings air into the lungs, the bronchi in terms of plural, singular is bronchus, and then the bronchi is a subdivision of the trachea when it enters into the lungs, and then the bronchi subdivides further into the bronchioles, and then till the end of the bronchioles, in terms of the terminal part, you will have these bunches of grapes or alveoli. And of course, all around the lungs, you have a pleural membrane. This pleural membrane is very moist. And the important thing to note with the pleural membrane is that this moisture is very important in terms of aiding with the absorption of oxygen. For those of us who probably are asthmatic, or if you have seen when somebody does have an attack or some issue related to breathing, when it is they do give them oxygen, you often notice that they will bubble it through a liquid, right? They bubble it through water. And one of the great things about that is that it's moistening the oxygen, as it were, and makes it easier to be absorbed at the level of the lung. So the take-home message is that oxygen absorption is enhanced or encouraged when it is you have a moist surface. That is very important. So here we have the respiratory system itself. Let's have a look. Here we have the sinus regions, the frontal and sphenoidal sinus. The nasal cavity, very important. Of course, these are the nares or your nose holes, bringing the air into the nasal cavity. Then you have the pharynx. In terms of what makes up the entire pharynx, is you have the oral or oral is closer to the mouth or oral cavity, nasal closer to the nasal cavity, and then you have the laryngopharynx, all right, very close to the larynx. So the names of the parts of the respiratory system associated with the pharynx has a lot to do with their location. Nasopharynx, close to the nasal cavity, oropharynx, close to the oral cavity, and the laryngopharynx, very close to the larynx or voice box. Here we have the epiglottis, right? Very important. Epiglottis is like a policeman on a street. It directs traffic to one of two places. Could you tell me, where does it direct things that are coming down through this region? Where does it direct them? One of two places. Somebody want to help me out?
The esophagus.
The esophagus, and the esophagus ends in the, The major structure that's in it initially is the stomach, and the other one is the, so it directs things down to the esophagus. So think about it, esophagus street, right? It's see food coming, it points to esophagus street. You gotta go so and go down by stomach avenue. And then the other one is the, that carries air. The trachea, very good. So the trachea terminates in lung boulevard, right? Lung boulevard, right? So very important. The policeman see air is coming, you go this way, go to the trachea. It sees food coming, points it, you go this way, you go to the esophagus, very important. Of course, sometimes we could have confusion happening here, and as the old people would often tell you, it's not a good idea to talk and speak at the same time. Sorry, not talk and speak, but actually talk while you are eating. Because what can happen if you talk while you're eating? Some of us might have experienced it. What can happen?
The food will go down to your wildpipe.
As often some
And you
people
choke.
would say, it goes down the wrong throat. Very good, right? It goes down the wrong throat. And when food, let's say, goes down your windpipe or trachea into the lungs, what reflex action is triggered? If food goes down into your lungs, what happens? What reflex action?
Coughing.
Right, your cough, right? The cough. Very
Yeah.
importantly, the
And the
cough.
food might come back through your nose.
Yeah, oh yeah, some people are familiar with
Yeah.
that. And what happens when
Or-
food comes through your nose? What do?
You blow your nose to get it out.
Yeah, and it's a little
Like-
irritating, yes, very true, right? So
Yeah.
you get the
And a
food out.
burning sensation.
You do get a ticklish sensation because that is not supposed to happen. Very true. All right, so very important there. You know, when I think about the cough, what do I remember?
Drink some water.
Yeah, you do have to drink some water, you know, to clear that up. Could anybody think about, is there a disease associated with coughing? And one of the
COVID.
major, COVID, yes, they're very true. That's a respiratory ailment. And another one, bronchitis, yes, that's another one. Is there any more? That and it used to be particularly
The
fatal.
common flu.
The common flu, yes.
Yeah.
Another one that was it was fatal. Let's say particularly back in the
H1N1.
60s, back in the 60s and 50s. It was
Spanish flu.
Spanish flu.
Tuberculosis.
TB, I was thinking about. Very good. Tuberculosis, right? TB.
Yeah.
TB is sometimes referred to as the cough, right? So if you hear somebody back then, you know, sometimes you hear people say he had the cough. When they talk about the cough, it's not a young cow they're speaking about, but instead they're referring to tuberculosis. And in fact, the current Queen of England, Queen Elizabeth, her father actually passed from TB. Right, King George the VI, I want to say, he had TB, and you know he passed, you know, because of it. Because back then it was a big issue in terms of having TB, tuberculosis. And so right now, how do they treat tuberculosis? One word: the major treatment modality. Notwithstanding isolation, not a vaccine. Not to my knowledge in terms of a vaccine, but it could be treated actually quite simply. Something that begins with A, not oncolytic. Right, not oncobiotics, but antibiotics, right? Anti means against, biotic refers to bacteria and other microorganisms. So antibiotics are given to them as it relates to TB control, but of course isolation as well. So when you look at respiratory hospitals, they're often like in Trinidad, the major respiratory hospital is located at Cora. Anybody visit Cora? Where's Cora located? Is it in the middle of a housing settlement?
No, not really. It's just
No,
on
sir.
the back of
Up in the hill,
St.
correct. It's up in the hills. And if you could imagine way back in the day, if you were to remove all of those houses and things now, which have popped up, it was in isolation. It just had a road, and the road used to just go up to the hospital. But one of the great things when you do go up to the facility, ooh la la, the breeze is something else. And that is one thing for respiratory ailments. You want to have a constant movement of air, right, across the person to keep things moving and to keep the air fresh. So that is why if you would look globally in terms of when they were building hospitals related to respiratory ailments, they would often build them up in the mountain where there's a fresh set of breeze to clear the air around the person, and also to keep them isolated as well, because up there, you know, you don't have a lot of persons around and so on. Let's continue. So you have the
No
pharynx,
air pollution.
correct? Yeah, and less air pollution. Very true. So here we have the pharynx, the larynx, and vocal cords. This is, of course, very important for speaking. The esophagus, as we mentioned, terminates partially into the stomach, and then, of course, the stomach into the small intestine, large intestine, and then voids into the anus. Here you have the left and right lung, and if you notice the trachea, And the trachea has cartilaginous rings around it. Now, why would you want these rings of cartilage around the trachea?
For flexibility.
For flexibility, that's one, very true. And inside of what you just said as it relates to flexibility is the answer as well, right? So flexibility is one. And what's the other thing you'd want to keep the trachea, with the trachea? Let's say you lie down. Would you want the trachea to close up?
No.
No, you'd want to
Until
keep it.
die.
Yeah, correct. You could go into asphyxiation, right?
Yeah,
So
suffocate.
where's another reason that you have these rings of cartilage? They're like a ring, eh? It's circular.
Okay.
Huh?
To maintain the structure.
Correct. I like how you say that, maintain the structure, to keep it open. So in other words, the trachea has these cartilaginous rings to keep it open such that the airway passage is always clear. That's very important. So
Yeah, I
that
was
air
going
could
to say
freely
to
go down.
assist with breathing.
It surely does, in terms of keeping that air flowing to the lungs itself. Here we have the mediastinum, as we mentioned. This area, this is where the heart is usually located or situated, right, in this mediastinum region, okay? The terminal bronchioles, and at the end of the terminal bronchioles, this is where you will find the alveoli. And as we mentioned before, the only place where gaseous exchange or the exchange of oxygen and CO2 happens, it only occurs at the level of the alveolus, which is found around the terminal bronchiole. It doesn't occur in the bronchus, doesn't occur in the trachea, only at the level of the terminal bronchiole. And the reason why it is done there is because you have these alveoli, which are surrounded by capillaries. And the good thing about capillaries, they are 1 cell thick. So
Blood
therefore, the
vessels.
gas could pass very easily in and out of the capillaries. So do remember that.
So what's the name of the process?
Ventilation, in terms of that movement of air across the lungs itself. But in terms of facilitating ventilation, or what happens, you have oxygen moving because of or it moves via diffusion. So it moves from its area of high concentration to its area
Low
of concentration. And in the opposite direction, of course, you have carbon dioxide moving from the blood vessels into the lungs itself. So that's how, and then of course you breathe out, and that's how you get rid of the carbon dioxide. All right. So we'll move a little freely through here, because we did mention these things, the nostril or nares, and then you have the cavities. As we mentioned, you do have mucus being secreted, and mucus is important. Sometimes mucus, if you do have an infection, you will see some interesting colors in the mucus, and that is sometimes referred to, when it's thick, it's referred to as catarrh, C-A-T-A-R-R-H. Catarrh is another word for snat, as we often call it, snat, right? So catarrh is really a thick mucus, and sometimes it does have some green stuff in it. The green are the remnants of some white cells which are fighting off infection. So the nasal cavities, it filters foreign bodies. It warms the air because of the fact you do have capillaries close to the surface there. Which, it is the inside of your nose is often crisscrossed with a lot of capillaries. And sometimes perhaps we know that when we have the cold and you blow your nose too hard, what happens? Yeah, they burst because of the fact these capillaries are very close to the internal epithelia of the nares or nose. So you always have to be careful when you're blowing your nose. Blow with sufficient force, but not too much, such that it causes any types of damage. All right. So and it also moistens the air. That's another important thing. As we mentioned, moist air is important because that enhances the uptake of oxygen in the lungs itself. You have the concha, which is if we were to go back, right here, the concha, it looks like the inside of a shell, right? I don't know if anybody ever opened a shell, right? But it does have these ridges. And because of the fact that it looks like ridges, they do call it concha. And one of the interesting things with the concha, it increases the surface area around the nasal cavity there. So again, in terms of maximal warming of the air, because we do have blood vessels as well crisscrossing that region. Right, then you have the nasal septum. The nasal septum separates the two nares or your nose holes. Some people, they put rings there or a little stud or what have you not. When you think about it, right, it's cartilaginous, mainly covered with skin, a thin layer of skin, right? So that's very important as well. And then, of course, you have your sinuses. Okay, let's speak about some other structures, the pharynx. right? This area carries air to the respiratory system. And we mentioned the nasal, oral, and laryngeal is so called because of its location. Nasal close to the nasal cavity, oral the oral cavity, and laryngeal close to the larynx itself. Let's talk about those structures which we just mentioned. The larynx, located between pharynx and trachea, and of course, it does consist of cartilage framework. And with males, you do have this thyroid cartilage, very important because this thyroid cartilage, so the thyroid cartilage, it forms this Adam's apple. And males usually have it more pronounced than females. Not precise, in fact, some females do have Adam's apple, but it is not very pronounced. Vocal cords, of course, very important, not only for speech, but for singing, right? So some people could sing very well. Anybody here could sing very well? I think silence means consent. That's very good, right? But very importantly, speech in terms of communication, very important for using that. Then we have the glottis and the epiglottis. We did mention the importance of the epiglottis in terms of directing things either to the stomach or to the lungs. What would happen if the epiglottis was not working? And it does happen. There is a condition, very rare, but it does. If the epiglottis is not working, what would happen?
You choke.
You choke all the time, yes. Anything else? Well, yeah, well, in a sense. In other words, food will go down into your lungs. Now, is that a problem if food gets into your lungs? What could happen if food continually gets into your lungs? One word, which is a bad word as it relates to the human body as it relates to getting yourself better. What is a bad word? A word you don't like to hear. And in fact, no medical practitioner likes to hear it. No nurse likes to hear it as it relates to wellness and so on. It's a word that begins with I.
Infection.
Infection, that's a very bad word, right? Very bad word, because infection could actually lead to further disease. All right, so infection, you need to minimize infection. So if it is the epiglottis is not working, food is constantly going down. One of the things with microorganisms, when they see food, what do? They replicate very quickly because they don't know how long it's going to be there. And of course, this replication, in so doing, they produce toxic waste, and then this toxic waste could have an adverse effect or a bad effect on you. All right, so very importantly, you don't want to have food where it's not supposed to be because that could bring about infection, very importantly there. Okay, so these, of course, are the vocal cords, and this area here is the glottis. We mentioned the epiglottis. Glottis form parts of the vocal cords, and of course, some people have different types of voices, and some people have very melodious, whereas some people cannot hold a note, but it doesn't really affect them in general. Let's go forward. Trachea, we mentioned this, conducts air between the larynx and the lungs. It's horseshoe-shaped, and it opens at the back for expansion during swallowing. So we're very familiar with that in terms of the trachea, that connective passage between the oropharynx, the mouth, the oropharynx, and of course the lungs itself. What is the most superior portion of the pharynx? Good question. Is it the septum or laryngeal? Which one is the nasal? Very good, right? So we mentioned the nasopharynx. That's the most superior portion. Very good, because that's the first part. You have the nasal, then you have the mouth or the oral, and then you have the last one, the one associated with the larynx or the laryngeal. Very good. Now we're moving down to the bronchi. The bronchi, in terms of its existence or its structure, the trachea divides into two primary bronchi that enter the lungs. The hilum and the epithelial tissue, and it does consist of hilum and epithelial tissue lining. Very importantly, there's pseudostratified epithelium with cilia, and these cilia are very important in terms of bringing things out, in terms of infectious material, in terms of food, taking them out from the lungs itself. So these cilia are like little finger-like projections, and they move in a wave-like action in terms of bringing things out. Very similar, if you look at the legs of a millipede, when you see the millipede going forward, right, or as we say, the congaree, when you see it moving forward, it's like a wave that passes. And that wave, similar wave-like action, you could imagine the cilia doing the same thing in terms of bringing things out of the lungs themselves. The lungs, of course, located on either side. Why do we have two lungs? One word beginning with B. Why do we have two lungs?
Backup.
Backup, and that's very important, right? For backup. Yeah, in case one lung goes bad, well, you do have a backup. You could survive on one lung, right? So very importantly, this notion of backup is repeated in the body. Could you think of anything else in the body that we have two of?
Kidneys.
Kidneys, very good, yes. Anything else we have two of? You could, I hear what is some people might want to say a brain. And interestingly enough, because it has been shown in younger persons, you have two brain hemispheres, right? The left and right hemispheres, cerebral hemispheres. It has been shown when they're under certain conditions, but they don't do the surgery anymore. There's a type of surgery called a hemispherectomy, in which they would remove a significant part of the brain of children when they were suffering from seizures. And what they found is when they did it, incredibly, the activities that were associated with that part that was removed would be shifted to the other half of the brain. Absolutely incredible, right? So that's how they did know in terms of plasticity as it relates to the brain itself, right? When hemispherectomies were performed, but they no longer perform them because it is rather dangerous to do, right? But the brain does have that ability in younger children to actually move some of the functions associated with one part to the other. And it has to do again with backup system. Let's go back to the lungs. The lungs,
Question, sir. A question,
yes,
please.
yes, please.
Are you saying that persons can survive with one section of their brain?
One of the
Is that
things,
what you're saying?
if it is in terms of at a certain age, but going forward, like usually in terms of this plasticity of things moving to one half of the brain, this would happen for children. The surgery was successful, usually children under the age of 14. When you go past that, after, older persons and 15, 16, 17, 18, it was not successful, no. So you would have loss of function, or the return of the function was very slow. For instance, I'm sure you might be aware there are certain persons who have strokes, for instance. So they're lost in terms of losing tissue mass associated with a part of the brain which is associated with mobility. And yet still they would regain a certain amount of movement. So it just goes to show that yes, you could lose certain types of functions with the brain itself, certain parts, and the other part compensates for it. In terms of, so to answer your question, could you then remove half of a brain of an older person and they would function normally? I really want to say no. I wouldn't want to say no. I want to say the plasticity only exists for younger persons. So I was just highlighting then in terms of the fact, I hear what you're saying in terms of having half of a brain or part of a brain in terms of functioning normally. That would only work for persons under the age of, let's say, 12, 13. But beyond that is not as successful. Yeah, so maybe using the brain was
Okay.
not the perfect example, as opposed to the lung. With the lung, yes, you could survive with one lung. Yes, with the kidneys, for the most part, you could exist with one kidney, but it's not so. It's a little more trickier with the brain. Yeah, the brain is a very special organ. I'm glad you pointed that out. Well done. Okay, let's go forward.
Okay, sir.
Right, so we do have the alveoli where gaseous exchange occurs, and then we have the diaphragm, major muscle associated with respiration. The diaphragm and the intercostals, these are the two sets of muscles, major muscles associated with respiration. And let's have a look at the structures. So here we are looking at the lungs. Here we are looking at columnar epithelial, which are pseudostratified. They're called pseudostratified because they have the appearance of being of different heights, but in fact, it's just that some cells are taller than some. So it gives the appearance of of different stratification, but when you really look, it's just one layer. And most critically, the goblet cells here, they secrete mucus. Right, we mentioned the importance of mucus. Mucus is not only is it sticky, so it entraps things which might come down into the lungs, and then they're able to move them out. Right, and again, we are familiar sometimes in terms of bringing out very special things from the lungs when we do have infections, special colored phlegm that comes out from the lung itself. All right, so here. Yeah, mucus, right, in the form of phlegm, right? When you, as I say, when you make a hawk and you bring up some specially colored items from the lung area, that is nothing more than mucus, with remnants of cells from the immune system, leukocytes or white blood cells, that gives it a nice green color, right? And then you do have shades of brown or red, and that is sometimes brought about because of the fact that the blood vessel or capillaries in particular, sometimes you do have rupturing of the capillaries. If the person is coughing a lot or coughing deeply, you could have rupturing, and this sometimes leads to the coloration of the mucus, which is brought out from the lungs themselves. Here we're looking at the lung, the right and left lung, and of course the divisions which we did mention as related to the lung itself. Here, notice how well the heart fits in, and therefore the left lung is slightly smaller than the right lung because of the fact it accommodates the heart, which is primarily located on the left of the midline, as we saw from our previous lectures. Here's the diaphragm, right, upon which the heart sits nicely. And of course, it forms the border at the base of the lungs themselves. Down here, what we're looking at these alveoli, or bunches of grapes, as it were, or bunches of chenet. Note here how they are crisscrossed with capillaries. And at this level, this is where you have exchange of gases occurring. All right, so in terms of the structure, you have pleura, which is connective tissue covering the lungs. You have parietal, visceral pleura, and then the pleural space, the space which exists, of course, between the lungs themselves. All right, where's the pleural space located? Right, so the pleura, this is the covering of the lung. It's a thin membrane, so it is found, of course, between the layers of the lung. So it's a membrane layer which is actually found between the lungs themselves. Very good. All right.
Question, sir.
Yes.
The alveoli, you said
Yes.
is the exchange of gases.
Correct.
Are you referring to like when somebody belch or when they go to the bathroom?
No, the normal
What
breathing
gas?
process where you have oxygen, oxygen being exchanged for
Oh, that type of gas. Oh
yeah.
my God,
Oh,
my
I
mind is
understand
so
what you were
fast.
saying. That one, the gas you're talking about belches, or if you're talking about
Yeah.
flatulence as it relates to going to the bathroom, that is really
Mm-hmm.
a byproduct of the digestive system, right? In terms of gases being found by the breakdown of different
Okay.
types of food products. Yeah, it's mainly that brings about either belching, as it were, or flatulence from the other end. That's a good question.
Okay.
So respiration process, ventilation, exchange of gases, and transport of the gases in the blood. Let's have a look at these things. So first of all, you do have inhalation in terms of the active phase, it brings it in. Surfactant, very important to keep the lung structure in its ready position. And we mentioned the definition of compliance, the ability of the lung to actually perform its functions. Then you do have expiration or exhalation, which is a passive phase. So the inhalation involving, of course, the diaphragm and the intercostal muscles, they come up and out, right? They come up and out in terms of bringing it here. And when you do breathe in, the ribs go up and the intercostals push the ribs out. So you're creating a maximal space for the lungs to expand. And also the diaphragm flattens. I like to call the diaphragm the guts pusher down our muscle, because that's what it does. When you breathe in, the diaphragm flattens and it pushes down, because what you're trying to do at this stage is to actually create as much volume for the lungs as possible. All right, so the interaction of the intercostals, the diaphragm, causes the expansion of the chest cavity. That is very important, as seen here. All right, gas pressure to volume. This is a very important relationship, and I'll speak more to this in terms of when you're breathing. All you have to remember is think about when you breathe in and you breathe out, the relationship is inversely proportional. So what does that mean? Think about a seesaw, and you have pressure on one side, you have volume on one side. And therefore, when pressure goes up, volume goes down. And conversely, when the pressure goes down, right, the volume goes up. If you're relating it to the volume, right, so therefore, when the volume of your lung goes up, what happens to pressure? Since they're on opposite sides of a seesaw, if the volume of your lungs go up, what happens to the pressure? pressure goes down, because think about a seesaw. So you have volume on one side, you have pressure on the other side. So volume goes up, pressure goes down. So therefore, when you breathe in, what happens to the pressure in your lungs? The pressure in your lungs actually goes down.
Builds up.
The pressure in your lungs actually goes down. So when you relate that pressure to the external pressure, is actually less. And how does air move? Air moves in terms of for diffusion. You do have diffusion occurring across pressure gradients as well. So in essence, air moves from the area of high pressure to low pressure. So it moves from outside to inside, which is why when volume increases with your lungs, the pressure decreases, air moves from the external environment to the internal environment. Let's see what happens when you breathe out as it relates to volume. When you breathe out, the volume of your lung decreases. So again, think about a seesaw. Volume is now touching the ground. What happens to pressure? Pressure goes up. So therefore, when the volume decreases in your lungs, the pressure within your lungs actually goes up. So how does air move? It moves from this high pressure region in your lungs to the relatively low pressure which is the external environment. So therefore, air actually moves from high pressure to low pressure. So in terms of the ventilation of air into and out of your lungs, is actually moved by a difference in pressures. And this is brought about by a change in volume. And this, of course, is facilitated by the intercostals and diaphragm muscles. So that's how gas actually moves in and out of your lungs due to the change in volume. It might be a little bit of a mouthful I just gave you there, but play with it and it would make sense in the long run. All right, so I just mentioned these are some of the volumes measures, so which are important. Tidal volumes, residual, inspiratory and expiratory reserve volumes. And these are just definitions. I would encourage you just to look them up in your spare time. Okay. Now, this is what I just spoke about, the process of respiration in terms of the pressure gradient and the movement of the air into and out of the lungs themselves. And then at the level, here it is in terms of when the air is brought in. I did mention at the level of the alveolus, you have is crisscrossed with capillaries, they're 1 cell thick. So now you can have the movement of gases into and out of the blood supply at the level of the capillary. And that is being shown here. Oxygen being moved from its area of relatively high pressure in the alveolus to low pressure within the blood itself. So this is blood being returned to the lungs for oxygenation. And of course, when you look at the red blood cell has a high affinity for oxygen due to the present, what's the name of the protein associated with the red blood cell? And this protein really loves oxygen. Yum, yum, yum. It loves to hold on to oxygen. Hemoglobin, very good. So the red blood cell or erythrocyte has this protein called hemoglobin, and once it sees oxygen, it grabs it up, right? There's only one thing, there's only one other thing. If it sees, it will let go oxygen and pick that up. Anybody knows what that is? Unfortunately for you, it could kill you. What gas that is? It's a gas that sometimes you get from cars.
Nitrogen, carbon dioxide.
You're close when they say carbon dioxide, not carbon.
Monoxide.
Thank you very
Carbon
much.
monoxide.
Carbon monoxide, very good, right? Not dioxide. Carbon dioxide means a carbon with 2 oxygen attached to it. You weren't far away. You were very close, right? But carbon monoxide, so carbon dioxide is CO2. Carbon monoxide is just CO, right? So carbon monoxide, very true as it relates to that. So that is one of the major ones. Carbon, if it does see it, it takes it out, which is why it's not a very good idea to start a car inside of a garage or inside an enclosed place. If you will notice, whenever you do see a garage, garages are usually have like either in the open or usually they have, if they are situated in a structure, it usually has a very tall roof. You know, it's very spacious so that air could pass, because carbon monoxide, it's an odorless gas, and it does build up when you have, if the engine is not working well, in terms of its function, you could have carbon monoxide being built up, the concentration of the gas being built up in the structure. And since you're not smelling it, you wouldn't know that is there. How do you know that you're experiencing carbon monoxide poisoning? It's a very simple way. Yes, because since it's odorless, how would you know?
Yeah.
There's a very simple
You
way.
feel like you can't breathe.
Tired.
Not that you can't breathe, believe you me, you'll be breathing. You get
Yeah.
sleep. There you go. There you go. you'll start to feel sleepy for no, and it's bright there, and you start to feel sleepy because of the fact the hemoglobin is no longer carrying oxygen around your body, of course. So therefore, the cells not getting the energy, so you start to feel sleepy. And then what happens? You begin to
You will
talk
sleep
to
to death.
you will begin to talk to the ancestors. All right. So anytime you see, let's say you're in a car or you're in a let's say a garage or something, and the engine is running, which is why it's never a good idea to start a car in a garage and the door is closed. All right.
So you can sit in a parked vehicle sometimes, just have the AC running because you don't know if there's a leak in the
Correct.
system.
Correct. Very true. Right. And next thing you're in there and you start to feel a little sleepy and drowsy. And that's the end of the show. So always remember that, right? Very good point you raised there in terms of that, right? So maybe
I
you
have a
could get,
question,
go
sir.
ahead. Uh-huh.
Well, not a question, a suggestion.
Yes.
I read an article in the newspaper, and this happened at some Airbnb or villa. The guests were there and they just sleep away. They sleep to their death.
Yeah.
And when they did, what do they call it, autopsy,
Autopsy.
they
Yeah.
found out, yeah, they died from
Carbon
carbon
monoxide
monoxide. So
poisoning.
I'm like,
Hmm.
yeah, so what if you're not in the position like in a garage or something? What other way could you use to differentiate that? You
You
know,
mean
this is a poisonous gas because you don't have any smell.
But so the thing is, in terms of its production, that's a very good question. It is usually only you don't usually have it around. The only way you could have it around is from a source, a particular source. And one of the major sources is when you're burning petrol or gasoline and it's not being burnt or combusted totally. So instead of carbon dioxide being produced, you have carbon monoxide. So the thing is, if you're saying down in your home, with very few
Mm-hmm.
exceptions, unless you are sitting down, unless the home is built over some type of dump or something like that, and you have carbon monoxide actually coming through from the earth, the only time you'll have carbon monoxide really coming through from the earth is if your house is built over a dump, or which was previously a dump or something like that. But normally, so in other words, normally, let's say you just have a garage and you sitting down outside, it doesn't normally happen. If you have an engine running, yes. So just the take-home message is stay away. Anytime you see engines are running in an enclosed area, not a good idea to be around. Open the door, open the windows or stuff like that. It's not a good idea. And similarly, simple things like, some people, lights go out and what do? You start a generator, it have some generators that work on petrol, you pull it and the engine is starting and so on. Yeah, even if you have those things running, have the generator outside, and then run the extension cords to it or what have you not. You don't want to keep the generators inside your home and then you lock up all the windows and so on. Very bad idea because you don't know how efficiently that engine is working and it could be giving off carbon monoxide and then that could lead to carbon monoxide poisoning. And in fact, I saw it on the news over in Miami, that sometimes that does occur, when lights go out and people use generators, the little portable ones, they bring them inside. And of course, when the night comes, they close up the windows and leave it running, the generator. Not a good idea. Always remember when you do have generators or the portable ones, leave them outside and run the cord or what have extension, under the door, through the window or something like that. But it's not a good idea to have engines that run on petrol in an enclosed environment because of the fact if they're not working well, they could produce carbon monoxide and it could lead to carbon monoxide poisoning. Okay? It's all good? It's all good. All right, 10 minutes again, and we'll call it a George. We'll call it a day. So oxygen transport, in terms of transport of oxygen, most is transported, as we know, and we just mentioned, by hemoglobin. That's the protein associated with red blood cells or erythrocytes. 10% is dissolved in plasma in terms of carbon dioxide. 15% is combined with protein of hemoglobin, and 75% is dissolved in blood fluids and is converted to the bicarbonate ion. So just the take-home message from this is do note that carbon dioxide is not carried like bubbles of gas, but it actually is dissolved and combined with other things and carried within the body. That's the take-home message from that. Okay, which of the following describe what occurs in the lungs? Oxygen diffuses into the blood and CO2 diffuses into the alveoli. Because these alveoli, of course, they then take the carbon dioxide out of the body itself. All right. So the last thing I want to mention for today, we'll just speak about the regulation of respiration. So when we're looking at respiration, the fundamental respiratory pattern is controlled by the central nervous system and partly in the medulla, partially in the pons. The pons is on the brainstem, and very importantly, it controls your respiration, and it could be modified by both receptors detecting changes in your blood chemistry. So, for instance, if it is detected that CO2 levels are rising, what would happen? What usually happens if your oxygen level is going down? What does your body do to compensate for that?
Goes to the reserve.
It goes to the reserve. Ah, yes, that's very good. Right, it causes the blood to release the reserves. That is one thing. But one of the things that we would recognize, what it would also do as it relates to that, what it does, it would cause you to breathe deeper, sometimes pant, you know. Right, so that is why our gasping for air, that usually happens when there is a large deficit. So that is very true. So the nervous control, right? Of course, the fibers control center is in the medulla and pons, as we mentioned, of the brain stem, and the fibers extend through the phrenic nerve to the diaphragm. You don't have to know all of that in detail. The take-home message from this is just to know that the control center associated with respiration is located in the medulla and pons of the brain stem. So in other words, in the brainstem, that is where you have control of respiration occurring. And do you know where your brainstem is? If you let your chin touch your breastbone or your sternum, and then you feel to the back where your skull ends to the back. Yeah, that region right below where the edge of your skull, right there is really where your brain stem is. Right, so notice it is protected very well because that's a very important function it has in terms of respiration. So regulation of respiration, you do have chemoreceptors, and again, they respond to raised carbon dioxide level. And when you, of course, raised carbon dioxide levels are detected, one, you could tap into the reserve, or two, of course, you could then begin to breathe in, the respiratory rate goes up in terms of how fast you actually breathe, the number of breaths per minute goes up. So in terms of abnormal, right, this abnormal ventilation, right, if you have high oxygen levels and low carbon dioxide levels, this causes, conditions under which you will hyperventilate, right? It would lead, of course, when you have high oxygen levels and low CO2, and of course, it would lead to increase in the blood pH. If you have hypoventilation, right, in which it will slow down, insufficient air in the alveoli, which then leads to decreases in the blood pH or the acid level. Normal breathing patterns, of course, with adults is 12 to 20, and children 20 to 40, and infants more than 40. I have a question. Why is it that infants' breaths are so much more than an adult? Anybody? For a very simple reason.
Their lungs are stronger.
Be a little more
Can be.
explicit. Yes,
It is faster
yes.
because they're smaller.
As it relates to the lungs,
Because, sir, remember they're small and
you say it right
oxygen
there. Sometimes you
moves
don't have
faster
the lungs are
around their
smaller.
bodies.
Yeah. So the lungs are smaller. That's very simply, the lungs are smaller. With adult, the lungs is bigger. Right? So both of you all said it. You were saying, and I know you knew it, you just didn't explicitly say it. Right? So yes, it's smaller. So therefore, they breathe more, little children, little bundles of joy, as they call them. All right? So these are some of the terms related to altered breathing. And in terms of inadequate breathing, what it could lead to, all right, some issues there. One of the things I want to highlight, of course, is suffocation. And why I highlight it, certain cases when some persons are asthmatic, what do you do as it relates to a brown bag and helping the condition, right? You place a brown bag over their mouth, and that increases the CO2 that they're breathing in. And the CO2, when the body detects increased CO2 levels, it could tap, as you rightly say, tap into the reserves of oxygen that is being carried around by the hemoglobin.
Nitrogen goes on.
Right. So it does that. But most critically, you have to use a brown bag and not a plastic bag. Why? Because believe you me, when somebody is asthmatic, right, they're breathing in very deeply. And if you put a plastic bag over their mouth, what could happen? Over their mouth and nose, what could possibly happen?
Suffocate them.
Yeah, they will suck in the bag. Oh, and now it is, first of all, you're looking at a condition where you're trying to treat, of course, somebody who was oxygen deprived. And now it is, you're trying to get a plastic bag out of their trachea or their nasopharynx, which is a totally different issue, you know? So
Also, the plastic bag, moisture from their mouth will cause the plastic bag to get wet and then stick together. So
correct.
it would not work.
Correct.
Yeah.
So that's why brown bag. I always used to think there was something special about the color brown, you know, and asthma, but it has nothing to do with that. But instead, is related to the fact
Does
that
it have to be a brown bag or just any paper bag?
just a paper bag. So in other words,
Okay.
paper bags keep their structure and doesn't collapse under breathing. Plastic bags will collapse under somebody who is breathing deeply, right? But paper bags don't. They will come in, but it wouldn't collapse totally. So it could be any color. It has nothing to do with the color. It just has to do with the paper content of the bag itself. All right.
So can I ask another question before
You
you go?
surely can.
When you were referring to the body goes use up its reserves, oxygen reserve, when a person have less oxygen within the body,
Mhm,
then the body will indicate maybe to the
mhm.
brain that you need to use the reserve. Is it the same procedure when somebody is dying? You know, when somebody is dying and they're gasping for breath, is it the same procedure or method?
That's a very good question, which I have never heard before. I've never thought about. It sounds logical. I
We're
just don't
losing
know.
you, sir.
Oh,
Hello?
hello. You hearing me now?
Yes.
Okay. That's a perfectly logical question and a perfectly logical response. I just don't know. I just don't know. It sounds perfectly logical
Oh,
because as you're passing, yes, in terms of, let's say, in terms of blood return from distal areas and so on, the oxygen content clearly is dropping. Your rate of respiration is dropping. And it could be, but I just don't know. But that's a very good question. That's a good question. See if you can research it for us for next day.
yeah, I'll
That's
ask
a
Google.
that's a very good question, and I never thought about that. Good question. Good.
Okay.
So some of the common respiratory disorders we mentioned, common cold, TB, and of course these days, you know, we're looking at COVID-19, right? That is of course a very special one there. We're not responsible for bronchopneumonia and lobar pneumonia, different types of, no, it's not. And respiratory disorders, no, these are not on the course itself. Um, SIDS, I'll just speak briefly to SIDS, also called crib death. It's just, they just don't know. You know, you put your child down and then you get up in the morning and the child is not moving, right? And that's the end of it. It usually occurs while this child is sleeping. So if you do want to find out more information on it, I would suggest you go preface your search by putting PubMed, P-U-B-M-E-D, before the word you're looking at. So put PUBMED space SIDS. It will take you, you'll now be accessing the National Institutes of Health database in the US. And you would get papers written on the topic as it relates to SIDS. All right, you don't have to know that. Cancer is not covered on this course. Pleurisy, no, these are not covered. Not covered. Not covered. So actually, not covered, not I would just, this would be the last thing we speak of, and the last thing actually covered here in terms of what happens with age and the respiratory tract. As you know, everything is getting old, so the elasticity of tissues is decreased. Compliance in terms of returning oxygen to the lung capacity as well as decrease. Susceptibility to infection, yes, there's a decrease because in terms of the thymus, as you get older, cells of the thymus, they are compromised. Thymus, of course, is where maturation of T cells occurs. So therefore, by extension, your immune system is weakened as you get a little older. Increased incidence of emphysema, emphysema or tissue fluid in the lung. Again, that has to do with the return of fluids, the relationship between tissue fluid within the blood itself, between the tissues and within the cells, the intra, and of course, blood vessel fluids. That relationship is damaged, as you get older, because of the fact the tissues themselves begin to lose certain properties associated with them that keeps them in tip-top shape, right? And of course, you have a reduced capacity for exercise. And again, this is related not only to the respiratory tract, but also to the aging as it relates to bones. The bones become a little more brittle. And one of the things, especially for persons who are a little aged, you don't want them falling, particularly as it relates to fractures of the pelvic region. All right. We don't need to know this. This will be covered in another module in a different one of your skills labs, right? In terms of those tracheostomy, in terms of those tubes, right? But this is not required for this course. Okay, so we'll stop there for today. All right, so we did go over the lungs, and in terms of the lung itself, we did mention in terms of their location, located within the chest cavity. In relation to the heart itself, the heart, of course, is superior to the lungs. The lungs are located behind the heart itself. The lungs, of course, the left lung has a bit of an indentation to accommodate the heart in terms of its structure. So therefore, the left lung is a little smaller than the right lung by structure. In terms of the movement of air into and out of the lungs, this is controlled by the relationship, which is known as V is equal to 1 over P. Long story short, the volume of the lungs is inversely related to the pressure. And as we mentioned, in terms of when the volume decreases, pressure increases. So therefore, air moves from area of high pressure to low pressure, moves out of the lungs. When the volume increases, as during inspiration, pressure decreases. And again, the air moves from area of high pressure, which is in the external environment, to area of low pressure, which is inside the lungs. So therefore, the air moves into the lungs. So we did mention that as well. We mentioned, of course, the respiratory pathway from the nares to, of course, the nasopharynx. Then you have the the oropharynx, and then the laryngopharynx. Then you come across the epiglottis, trachea, bronchi, bronchioles, and then, of course, terminal bronchioles, and then you have the alveoli, which are crisscrossed with capillaries. These capillaries are very important for gaseous exchange. And again, we did mention in terms of that movement of oxygen into and out of the capillaries, that is facilitated by a diffusion, very simple diffusion, movement from the area of high concentration to an area of low concentration and vice versa. All right, and then of course we did mention other things, but those are the major things associated with what we looked at today. All right, any more questions? And of course, we did have a nice little session as related to carbon monoxide poisoning. That was a very good point that somebody raised there. And always remember the take-home message from that. Try not to be in an enclosed space when there's an engine which is burning gasoline present. If there is an engine present that's burning gasoline, open the spaces, get the engine outside, because it could lead to carbon monoxide poisoning. And as we did mention, carbon monoxide is odorless. You have no clue that it's there. You'll just start to feel sleepy, and then suddenly you'll be talking with the ancestors. All right. Any other questions?
So just I wanted to find out for the lab classes. I remember you had done a again going to see what timing we have or just the classes in the weekday is it. I just wanted to confirm that and the activity sheet.
The activity sheet, right. So for this week, we'll be starting the activity sheet. So for next day, what I would want you, I'll give you a little bit of homework, but I would want you to complete the activity sheets related to the 3 prior topics, all right? Okay, that's probably a bit much. So let's do 2, relating to the blood and the heart. All right, so those 2 activity sheets related to the blood and the heart. Is there space for it to be submitted online? Is it multiple choice?
No, so I don't see a space.
No, sir.
No, it's not. Okay, I'll have to, yeah, okay. So just do them and bring them for next class day. All right? So
You don't want us to email it, sir? Email it to you?
Email it to me.
I'm asking. I'm just asking.
Yeah, thinking. Let me think about that one. But for now, bring it, bring it next week. All right. I mean, going through as an exercise, but I'll give it some thought.
Okay.
All right.
And so one more
Okay.
thing, I know
Oh, just one
in the
thing. I would.
classroom.
Just one thing. I would come right back to you. Yes, I didn't finish answer the question that the young lady had posted to me. So coming right back to you. Ooh, ooh, ooh.
Okay.
All right. Yeah. So yes, we would. So in terms of the activities, blood and the heart, those two things. Let me take a write down of it. Right. Just to make sure I myself remember. Right. Right. Um. And sorry, I could only think about one thing at one time. I'm not young like I used to be now. So that's why I have to just take things, one day at a time. Yeah. Let me see this now. I don't want PBL anyhow. This is SNF2. SNF2. So one, so do blood and heart worksheet for next day. All right, so the person who asked that question, it was a two-part question you asked? Yes? Was there anything
Yes,
else? Yes.
yes. The
What's
other
part
part
two?
was the labs. I remember you had did
The labs.
surgery, the labs. Yeah, is that a
So
separate class or
yeah, so
the
thus far
package?
it will be. So, but in terms of how the labs will run, in terms of my understanding, you will be sent either a link or the video itself, well, a link to the video in which you will be seeing what, like the technique, and then there'll be a worksheet based on what you're seeing. So with that one, it'll have very little user intervention. You'll just be watching the videos and then doing out the worksheet. So I will comment on that. Let me see for next class day. I'll have an update for next day.
Yeah.
Okay, the labs. All right. So to my friend who was asking the questions and I cut you off, if you would, who was it? Somebody was asking a question and I said, just hold
Yes,
on.
yes.
Gabrielle, go ahead.
I was just saying that not too long checked on e-classroom and I didn't see the video with the blood with Miss
Sata,
yeah,
Dr. Sata,
yeah,
not a
yeah.
problem because, okay, I would send it to you. All right. So look for the link tonight either on, not either, I would put it in WhatsApp. Okay.
Okay, okay, thanks.
Let me put it down. Video on blood to push on WhatsApp for SNF2 plus other videos inclusive of today's respiration. Okay, yeah. All right. Anything else?
So the worksheet will be for Max by chance?
Yes.
Yes, it is. And I'll give you a
Okay.
breakdown. That's one thing. I will send a breakdown. Send breakdown
So you're posting the video,
of
sorry,
marks.
in WhatsApp.
Just 1 second. Let me just finish
Oh,
with the young lady here. So send breakdown of marks allocation for exercises. SNF2. Okay, go ahead. Yes. Sorry for cutting across here. Go ahead. You were asking a
no,
question
that's
now?
okay.
No,
I
go
was
ahead.
asking if you're going to post the videos
Today's video?
in WhatsApp and the others in WhatsApp or the e-classroom, just to make sure if you said something out of the
Usually
way.
I put it in both. I put it in
Okay.
both, right? I'll
All right.
post it
No
both.
problem. Thank you.
But definitely in WhatsApp, yeah, because everybody have that have access to that. Good. Anything else?
Yes, sir,
Go
excuse
ahead.
me.
Yes, go ahead,
I
Leah.
I know we're on the third topic. After the next topic, then it's cost. The first in cost. How soon could
So
we?
what I would do by Friday, which is day after tomorrow, I will send you um, the dates for assessments. Okay, so you would know. It wouldn't be so soon. I don't
Okay,
think.
sir.
Yeah, I don't like to drop things. I like to give people at least 2 weeks notice. I don't like to just drop it on them. Yeah, so I'll send that to you. All right. Anything else? That seems to be about it. Well, it has been my distinct pleasure. Leah, Alyssa, Denicia, Gabrielle, Gemly, Giselle, Janaya, just Kadisha, Kamina, Christina, Lakeisha, Michaela, Makeda, Maria, Nikisha, Sabrina, Sadna, Sarita, Sienna, Stephanie, and Makeda. Has been my distinct pleasure, and do have a good night. This video will be posted by 8 o'clock tonight. Have a good one. Good
You
night.
Bye,
So,
sir.
sir.
Good
Thank
night.
you.
Bye.
I
Okay.
didn't hear my name though.
Which name is that? Sorry.
Renita.
I do apologize. I apologize profusely, Renika. Let me just make sure I see it. Oh, no, I
That's
missed it.
okay.
You saw,
That's
you saw
okay.
it? Let me see. You see it on the list here? Well, oh yes, I'm not seeing it there. It jumped over. Renita
Mars.
Marston.
Yes, sir.
Yeah, I'm now seeing it. You know why?
Okay.
Your name is actually directly below mine. So the list was just a little
Okay.
lower, and I started as Alyssa. But your name is actually first in line. Yeah, RM, Renita. I do apologize for that, Renita. That was
That's
just an
okay. No
oversight.
problem.
Okay, have a good
Yeah.
one. Good
You
night.
too, sir.
All
Bye.
right.
Bye.
Goodbye.